Arizona Science is supported by Research Corporation for Science Advancement.
For AZPM, I'm Leslie Tolbert, Regents Professor Emerita in Neuroscience at the University of Arizona, and this is Arizona Science. Today our guest is Kacey Ernst, Professor and Chair of the university's Department of Epidemiology and Biostatistics. Kacey's an expert in the many factors that influence the spread of infectious diseases in diverse populations, both in the U.S. and abroad. Welcome, Kacey.
Thank you so much for having me today.
So you have a very long-standing interest in the spread of disease by insect vectors, such as mosquitoes, for instance. What are the key environmental issues that affect this problem, both in the U.S. and abroad?
It's a pretty complex system, which is why I was initially interested in working on vector-borne diseases. So first of all, you have to determine if the system has only humans involved or if it also has animals involved. So something like West Nile virus, the reservoir is birds. So that adds another complicating environmental factor.
You're also especially interested in the spread of diseases like COVID, and these are diseases that are potentially preventable by vaccination. Tell us about what you're learning about why some people get vaccinated, why some people don't, and how important it is as the essential way to control the spread of the disease.
Yeah, so prevention is worth so much more than cure. We do have treatments for COVID, but they're not as effective as if you can get vaccinated and prevent being infected in the first place. And sometimes people do get infected after vaccination, but their cases are usually so much more mild. They're much less likely to be hospitalized or die.
There are large segments of the population who are deciding not to get vaccinated. What is it that drives that determination?
You know, I think there's sort of several camps of people. There's the people who are just completely opposed to getting vaccinated, and they're much harder to reach. There's also sort of a middle population that's just uncertain, and trying to reach them can be quite successful, trying to understand and answer their questions about safety issues, et cetera, can really be helpful. I think there's also growing polarization in our country. Unfortunately, vaccination has been something that has been highly politicized. And even though health matters and concerns related to public health ideally are not political issues, unfortunately, they do become so. And so I think that if your political camp is opposed to vaccination, I think it's sort of psychologically, you tend to sort of go along with the other ideals of your camp.
So tell us what you're doing here in Arizona with your We Health project that sort of addresses these issues.
Yeah, so we have two projects that are sort of mobile health projects. One is We Health Notify, and We Health Notify is something that was also known as COVID Watch during the early stages of the pandemic. And it was that exposure notification system where if your cell phone was in close contact to somebody who had COVID and they reported into the system, you'd be told, hey, you've been exposed. We've been repurposing that app. So the We Health Corporation, run by Samir Halai, has a nice partnership with the University of Arizona, and we've been repurposing it to try to address more of an all hazards preparedness concept.
Are people indeed paying attention to the alerts that you send out?
I think so, but when the people who are more likely to download and use an app or use a system like that are not typically the people that you need to reach as much as others who are not as maybe health conscious or interested in sort of science-based information. So it becomes a challenge that you may be speaking to people who are already invested in trying to take these prevention measures. I think they say that it takes, 9 times for somebody to hear something before it starts sticking in their mind as something that they'll pay attention to. So repetition of science-based information is really critical to starting to move that needle and building trust. I think during the pandemic, there was a lot of trust that got lost between the public and public health, and we need to work really hard to regain people's trust and to build that trust when there's not a crisis.
Well, this is really exciting to hear about. What you're doing is so important. Thank you.
Thank you so much.
Kacey Ernst is an infectious disease expert with a special focus on environmental impacts on public health. You can listen to this and all Arizona Science conversations at azpm.org/Arizona Science. I'm Leslie Tolbert.
Thank you to Research Corporation for Science Advancement for their support of Arizona Science.